So some of you who are watching the OCMCA March 2025 protocol briefing noticed they said when they talked about the spinal assessment or spinal precautions protocol that there was a little nugget at the end where they said if you have a patient that refuses a C-collar when a C-collar has been indicated, you have to have them sign to refuse that treatment. So that begs the question, how do we do that? How is that done in ESO? So here we have an example of a patient who has been drinking. He was assaulted. He doesn't want to go to the hospital, but we feel, he needs to. So we've contacted medical control because you cannot kidnap someone. If you have a patient who has not cleared the capacity assessment, meaning they are not competent to refuse care, that doesn't automatically give you a license to take them against their will. Protocol says that you have to contact the hospital and get permission from medical control to either allow them to refuse care or get direction to take them against their will to the hospital. Now, this is very rare that a physician would give you an order to take a patient against their will. But if you need to, in this case, the patient has been drinking and we don't want to take the risk of allowing them to sign off and then having something unfortunate happen. So we're going to load the boat by calling medical control. And in this case, the physician said to the patient, listen, you need to go. It's very important. Here are the consequences if you don't go. Patient agrees to transport, but patient refuses a C-collar. Okay? Now, the patient has a right to refuse care. Okay? You are taking them to the hospital. They have a right to refuse care. What is the alternative, right? Are you going to hold the patient down and force a C-collar on them when they are unwilling to wear a C-collar? No, it doesn't make any sense. We should also make sure that we document in our narrative that we advise the patient of the risks of refusing spinal mobilization with a C-collar. So after you've documented in your narrative, the next step is to go into your flow chart and document that a C-collar was attempted but was not successful. And in the comments section, you can write that the patient refused the C-collar. Okay, then the next thing you'll go to will be the signature section. You'll go to refusal, and after you've done the other things in here, you're going to go down to the refusal section, open up patient refusals. You're going to indicate the patient refused treatment, and you're going to say patient refused C-collar. And have the patient sign. And that's how you do a refusal of treatment.